Hi, my name is Devyani Hunt, and I welcome you to the Washington University Living Well Center for our Facebook event. I am the chief of the Physical Medicine and Rehabilitation Division in the Washington University Department of Orthopedics and the medical director of the Living Well Center. We're very excited that we opened our doors here at Barnes-Jewish West County in June of this year, and are excited about all the programming that we have to offer our community. Our focus is an intensive lifestyle medicine focus to improving health and wellness of the whole patient throughout their life. So we start with thinking about how we exercise, how we use food, how we use our social connections, and if there's any barriers to our success, and really kind of delve into what our patients' goals are. And most of the time, these goals are some kind of functional goal or musculoskeletal issues such as bone or joint, and or it could even be an athletic endeavor. It's usually a 90 to 120-day program, and we have weekly to monthly appointments, and the patients meet with multiple providers, and we work together in a true multidisciplinary approach for patient care. So within our walls, we have a few different disciplines. We have doctors, nurses, dietitians, acupuncturists, psychologists, physical therapists. And I'm actually here today with my colleague and friend, Dr. Chi-Tsai Tang. He's an accomplished physician and acupuncturist for the Living Well Center. So we're going to have a conversation today about the center, about acupuncture, and I hope we learn things. I think every time I talk to Dr. Tang, I get lots of great information. So hopefully you will too. So Dr. Tang, would you like to introduce yourself a bit?
Sure. My name is Chi Tang. I'm a physiatrist, so that's physical medicine and rehab, same as Dr. Hunt. And I went through medical school in North Carolina. Then I did residency at the University of Michigan. Then I did a fellowship in sports medicine here at WashU. And so as a part of my practice, I do acupuncture. So, and it's been a part of my practice for 11 years now. And it's actually becoming a bigger and bigger part of my practice. A lot of that is from a need perspective, because it's such a great tool that we have to treat patients, I have actually 2 full days of acupuncture that I do now. But that's, I incorporate all of my other medical knowledge into the whole thing, into everything, and coming up with a good treatment.
And I think that's what is so important and makes you kind of stand out from the rest, is that you can take all bits of the things that you've learned. You've got this huge toolbox and put it all together. So how does that work? What was your journey of getting to this point?
Yeah, that's so I initially, when I was learning acupuncture, I took a course. It was a 300-hour course for physicians. It's called the Helms Medical Institute course, and I took that in 2009. And then so I've been doing acupuncture ever since then. And then in 2013, I took a board certification, added board certification to do acupuncture. Actually, in the U.S., most states, you actually don't need board certification if you're a medical doctor to do acupuncture. But I kind of took that extra step. And then also in 2015, I was able to go to China and meet a famous acupuncturist. And after that, I also did a short sabbatical in China to just learn more. So, I have some pretty extensive training in acupuncture, and I've been able to kind of incorporate, my medical knowledge and other knowledge into trying to just find the best treatment for patients.
That's great. And, I've known you through the years, I think more than 10, 12 years now. One of the greatest parts about how you think is that I think you come from this background of engineering, right? That your undergrad degree, and to be able to kind of pick things apart and put it back together. And you do that for musculoskeletal care for the body, and now being able to do that and incorporate the acupuncture side of it. Was it hard to let go of some of the things that you learned and then kind of refabricate in your mind?
Actually, I think it's been very exciting. I think that for me, things have to make sense to me. And so, acupuncture is based out of traditional Chinese medicine. So it's a very ancient medicine. And if you sort of read their textbooks, a lot of things don't necessarily make a lot of sense from a Western medicine perspective. So they talk about energy circulation, qi circulation, kidney yin deficiency. So just a lot of kind of weird concepts that may not make sense. And the acupuncture that I do now, I've been able to incorporate kind of Western medicine into things, and it actually the results have been much better and much more reliable. So you're absolutely right. So the acupuncture that I do now, I incorporate sort of my Western medicine biomechanical knowledge, and it really helps me to figure out where to needle, what to do, and it's a comprehensive approach to figuring out what to do for the patient. But it was actually very exciting that I was able to have everything make sense to me. Kind of the two worlds sort of meet together. I guess I've heard an analogy before where actually my mentor, Dr. Guan, talked about this, where kind of like you have Chinese medicine. It's like you're scaling a mountain. So that for Chinese medicine, they're coming up from one side of the mountain, and Western medicine, they're coming up from the other side of the mountain. And then, but once you kind of understand both and you get to the top, you can see everything. And so you get a very good view, and you say, oh, okay, I see the truths in both sides, and you can kind of incorporate the whole thing.
That's a great analogy. It really does come to light, and I've seen that in a lot of the patients that I've sent to you, mm-hmm. and how they can really benefit from that bird's eye view.
Cool.
Can you tell us a little bit more about the science behind acupuncture? I mean, I feel like myself, personally, I've seen it work so well and been amazed at kind of the things that you can do right away with it. We as physicians, sometimes, we go down the road of seeing a patient, diagnosing, and then a management plan that takes a while. So to be able to have something that you can change, the tone of a muscle, the way the joint works, the pain of a person is pretty remarkable. But then, that other side of us, like, well, how does it work? So can you give us some insight into the science behind it?
Yeah, so that's a good question. So I think one thing is that acupuncture probably works by different mechanisms. So it's not just one way of how it works. And also, the needle is really just a tool. So it's manual medicine or manual treatments with your hands it's another tool. So the needle is actually just a tool. And so but depending on what you do with the needle, you can invoke different responses. You're probably getting different mechanisms depending on what you do with the needle. Like if you stick it deeper, if you leave it superficial, if you manipulate it, if you put electrical stimulation on it, you're all sort of invoking different mechanisms. But some of the kind of major ones of how acupuncture works. So number one is it helps to deactivate what are called trigger points. So these are like knotted up areas and muscles. So it's very good at deactivating trigger points. And actually trigger points are a huge source of pain for people. People have all the muscular pain, knotted up muscles are a big problem for a lot of people. So it can work on that. It also works on the fascia. So the fascia is like the lining of the muscle. So, if you take like a chicken skin, there's like a glossy lining, so that the fascia is connects the whole body. So even though we have separate muscles, you have fascia that runs from the same fascia running from your toes all the way up to your head. And so the acupuncture can modulate the tension of the fascia. Acupuncture also helps the body to release release endorphins in the body. So those are chemicals that your body produces itself that helps alleviate pain, like you get endorphin release with exercise, for example. It also kind of modulates the brain, so it can kind of cause different signals in the brain, different signals in the spinal cord that can help alleviate pain. It also can affect the sympathetic and parasympathetic system. So that's like your fight or flight response versus the rest and digest. So it can kind of reset some of those, like if you're very tight and anxious and the sympathetic system is going in overdrive, you can kind of reset that with the needle too. So I guess the short answer is it does a lot of different things, but these are just, if you look at the studies, these are some of the more proven mechanisms by how acupuncture can work.
That is fascinating because, I've seen that, firsthand. So we, in the Living Well Center, we are often working together. And so I'll be in clinic as well as with Dr. Tang. And we try to take some measurements of how people are feeling before and after their sessions, and it's been amazing that not only are they able to move their foot more and or they have less pain when they bend over, but also the sense of kind of maybe grounding, less anxiety, just like people just feel more at peace. And I guess that's where that parasympathetic and sympathetic system comes in, which it was kind of surprising to me to actually see it in flesh and blood.
Mm-hmm. Yeah, no, definitely. And so, the acupuncture that I do and you do as well, one of the nice things that you've mentioned is that you get immediate results. So that's a little bit different than kind of typical acupuncture. If you go see a licensed acupuncturist, most practices are set up, you kind of maybe lay on a table, you put a bunch of needles in, then you leave them there for like 15, 20 minutes, then the patient comes back next week. You don't get as much of that immediate feedback. But the acupuncture, that we do here, you sort of expect some immediate improvements. And, that I think that's really huge, especially for people that have had maybe chronic pain for a long, long time, kind of just knowing that there's hope, that we can help them with their pain. I think that's very big for them.
It really is. And I feel like it helps facilitate too. So if we can, again, decrease pain, then they might be able to do more in physical therapy and get to the next step of improvement. It's also been interesting to see kind of how often you have to do it, and kind of what are the specific parameters of how you treat someone. So as Dr. Tang mentioned, I've been doing some of the acupuncture too, taught by Dr. Tang and Dr. Guan, who visited from China. And I feel like sometimes I've started to use it somewhat diagnostically. Would you agree too? Meaning that, if I'm thinking that it might be one or two things, if I needle this muscle and it releases, or that's just one specific, example, then I know that I'm kind of on the right track. Is that the way you did it? Use it too?
Yes, I think I agree. Yeah, to a large extent. So sort of, I think if I can needle someone and, like you said, release certain muscles and their pain is better, then we at least know that there is a myofascial component to their pain. But one thing that's a little bit tricky is that if you needle them and they don't get better, it doesn't mean that there's not myofascial pain, because maybe you didn't needle the right location, for example, or maybe the technique was a little off, or the muscle didn't release or something like that. So I don't think that necessarily means it's not, or that it won't help. So that's a little bit of the tricky thing with acupuncture. It helps so many conditions. And even pain that's really vague or just hard to pin down, we get a lot of patients that have a hard time describing exactly what their pain is, right? And so, but acupuncture can treat those things, whereas a lot of the typical Western medicine injections, that's a very targeted approach to a target specific problem. And a lot of times our patients don't fall into those nice E categories, but it's okay. The acupuncture, you can kind of do so many different things with the acupuncture needles that you can usually find a way to kind of, treat their pain.
Yeah, that's a good point. So maybe describe to us kind of what the typical treatment regimen would be like for a patient.
Yeah, so typically when I see someone, I usually make them come in for we call it an acupuncture consultation. So I'll kind of review all their medical records, kind of what they've tried up till now, look at their imaging, and then I'll also do a very comprehensive physical exam. So kind of, get the full picture of what's going on. And then if usually there hopefully will be a little bit of time left over, and then we'll do like a brief treatment that session, that visit. And one, it allows them to like make sure they can tolerate needling and that they do well with it. And then also hopefully to show them that they can get some pain relief with it. So that's typically how the first visit goes. In terms of subsequent visits, usually I usually say give it like maybe 4 visits or so. The acupuncture that I do, usually you get a little bit quicker results than some of the more traditional Chinese medicine acupuncture. Typical course for traditional Chinese medicine acupuncture is maybe like 8 to 12 treatments. I usually can get people better in like 4 to 5. So it's a little bit of a shorter course. And after 4 sessions, usually you have a pretty good sense of where this is going to go. And a lot of times I see some very chronic patients, so not to say that they're all fixed after 4 sessions, but a lot of them will be somewhat better. And then we'll have a direction to go in. So for example, if like, if I'm releasing their pectoralis muscle, here in their chest, and they get relief, but it just keeps coming back after 1 week or 2 weeks, maybe sending them to a massage therapist to really work that area out is the next step. So at least we know like what areas are effective, and then we just have to figure out how to get those the sustained improvement, and then maybe they need an exercise program afterwards to kind of pull their shoulder back, for example. The acupuncture, I think, is a really good first tool to get the ball rolling, get the pain a little better, to kind of get them on the road to recovery.
That's great. Mm-hmm. And you mentioned working in concert with massage, and then we also do that with physical therapy too. And I get a lot of when I talk about acupuncture, people are also used to hearing about dry needling, and ask me kind of what the difference is between the two. You want to expand on that a little bit?
Sure. Yeah, happy to do that. So actually, I would say that the distinction between the two is probably less than most people think. So part of it is who's doing it. So dry needling is performed by physical therapists, whereas acupuncture is performed by acupuncturists. So the acupuncturists usually go to acupuncture school, so they don't, and it's a separate educational process. And I think most people are familiar with physical therapy and how that goes. So who's doing it? And then medical doctors we sort of do both, basically. You can call it what you want, but some people will call what they're doing dry needling. Some people will call what they're doing acupuncture. And then also a big distinction is kind of where it came from. So like acupuncture is derived from traditional Chinese medicine. So it's been around for thousands of years. As I sort of alluded to earlier, they talk about a lot of energy circulation, things like that in the more traditional acupuncture sense. But actually there's a lot of other acupuncture that is more anatomic based, more Western medicine based as well, and that's still acupuncture. And a lot of people in China do that too. So acupuncture is not all just qi and energy circulation. And then dry needling is more derived from Western medicine, and so that is mainly for releasing muscle. So if you needle a muscle, it'll release the muscle, and so that's kind of the principle for dry needling. And then the indications are a little bit different too. So for dry needling, it's mainly just for myofascial pains, just muscular pain. And acupuncture actually can treat a lot of other things like digestive issues, for example, like irritable bowel syndrome. It can help with insomnia. It can help with anxiety. So it has a lot of other applications. It has a wider scope. So anyways, I sort of think of dry needling as a little bit of a subset of acupuncture to some extent, more like a Western medicine, a little bit of a subset of it, because I think there is a little bit of a misconception of acupuncture of being a very small, like kind of well circumscribed thing, whereas actually in reality it's a very big basket.
That's a great explanation, because I sometimes struggle to figure out the difference too, and to know how I'm using it in particular, but it is like acupuncture. The more I've studied it too, it just is very broad. So and it relates back to how people do it and why some types are more beneficial for certain diagnoses. So, in our world, the musculoskeletal world of taking care of bones and joints and tendons and such, being able to use that structural based side of acupuncture, again, is just so powerful. Mm-hmm. So a few big questions I think people always ask me is it painful?
Is it painful? Yeah. So, I would like to tell you that no, it's not, but that would be lying. So the acupuncture, actually, I can show you. The acupuncture needle itself, when it goes in, is really not that painful because the needles are tiny. So I have, this is kind of what they look like. You're familiar with these, Dr. Hunt, but they're individually packaged now. They're sterile. So you take one out and it has like a guide tube, and then the needle in the middle. And then it's got a little plastic chip that holds it in place. So you just kind of, you take the plastic thing out, and then you can kind of, you just kind of basically, you just tap it in. So really easy. So the needle going in, you really don't feel it at all. I mean, it's so tiny. They're like 36 to 38 gauge. which is if you take the Western medicine gauges of how big they are. However, what if you contact and release a muscle, patients will oftentimes feel something, and some patients it doesn't bother them, but a lot of people it kind of does. And so what you feel is potentially like a deep ache. You might feel like a shooting pain, like a numbness. Oftentimes you get a big twitch, like the muscle will twitch, and it'll sort of surprise people. And so that part can some people feel like it's a little bit uncomfortable. I mean, some people don't mind it, but so I guess that's sort of the short answer is that you'll get some sensations with the treatment, but it's not what people think of the pain from the needle getting inserted. It's actually when you find a good area to release, you get other sensations.
Got it. And then, so it's a kind of short-lived though, because you wouldn't expect longer-term pain after a session.
Oh, correct. So I've had people say, and it depends on how aggressively you needle an area potentially, and also maybe how problematic that area is. I've had people where they've had pain for 4 or 5 days potentially. I would say that's the upper end of that. Some people don't really have any pain. Kind of 1 day is pretty typical. But the nice thing with the acupuncture is that, if you do it properly and you know your anatomy and you do it in a safe manner, you're not going to cause any harm. Like, it's not like, people worry, oh, it hurts. Is there something wrong? Like, it's extremely unlikely if you do it in the right fashion that you're going to cause any damage or anything like that.
Right. Got it.
Yeah.
Do you want to share the self-study that you did on your own nerve?
I can.
Dr. Tang, what's
yeah. Yeah. So, so I did this study with one of my other colleagues, Dr. Chang. But what it was, so one thing with acupuncture that was always sort of interesting to me is that there are a lot of different acupuncture points in the body, and a lot of them are actually over peripheral nerves. So they're over nerves. But then if you look at the medical literature, there's really no reports of like nerve damage. It's very rare. I mean, very, very rare. So it's like, but if you're getting needles stuck there all the time, and you would expect maybe you would get some nerve damage. So I was like, okay, what's going on here? So what I did was I do a lot of stuff with ultrasound too. So I can look at needles and look at nerves and different structures with ultrasound. So I did I had Dr. Chang stick a needle in my arm and go into my radial nerve, which is it's a nerve down my arm. And we guided the needle using the ultrasound. So I knew that it was going to the nerve. And it was interesting because actually I felt some electric zings and shocks down my arm. But it actually happened before the needle was even close to the nerve. So I knew exactly where the nerve was, but it wasn't in the nerve, and it felt like a nerve. And it zinged like twice. And then actually when the needle was in the nerve, I kind of didn't feel much of anything. So it maybe a slight deep ache a little bit, but not much of anything. So that's kind of a very interesting observation, because, you think that when we're doing the acupuncture and someone feels something zinging down their arm, oh, I hit the nerve. But that may not be the case. A lot of times myofascial pain, the muscles and the fascia, like we talked about, can give very similar radiation patterns and even like the numbness, tingling, but what you would think feels like a nerve pain. So anyways, yeah.
I love that story. Like,
Yeah.
one, your dedication to the cause, and two, that you didn't really feel it. And I think you also told me before too that it kind of rolled out of the way too. So it's
right. So yeah, that was the other thing. So yeah, so if you needle it relatively slowly, or just going in there like a normal speed, the nerve sort of rolls out of the way a little bit, and that's probably for a normal nerve. If a nerve is abnormal, maybe it's tacked down to the fascia. It may not. We don't know that for an abnormal nerve, but for normal nerves, it does seem to roll out of the way. Yeah. Great.
So another study in good safety and ethics.
Yeah, exactly. So I've done it on myself, as we just saw, and I've even stuck my own nerve, and I'm
Right.
I'm okay. I didn't die.
Right. Very good. All right. So the other big question people ask me is, how much is this going to cost me?
Right. So so unfortunately, most of the time, acupuncture is not covered by insurance. And then if it is covered, sometimes they have very specific indications for when it's covered. So I always have asked patients, you need to talk to or call your insurance company to figure it out, because it really does depend on not only what insurance company you have, but what plan within that insurance company that you have. But typically when I see a patient, the session costs $200 per session. It may seem like a lot, but it's sort of comparable to what we would get reimbursed for a clinic visit as well. So unfortunately, that's just how things are.
Yeah. Yeah, I know. I do wish that it was more accessible to all. And that's kind of one of our missions at the Living Well Center, is to see how we can make it more accessible to all, because it can be such a powerful tool.
Mm-hmm.
So you also mentioned too that there are a few different indications. So we use it most commonly for these musculoskeletal issues, but there's a wide range of what you can use it for. I think I probably don't even know all the options or opportunities for it.
Mm-hmm. Yes. So I think honestly, my practice has been limited primarily to musculoskeletal and pain complaints, and obviously there's enough of those to go around. So sometimes on the side, I will treat a little bit of something, but usually people get in to see me for some sort of pain complaint, or a functional complaint. So that's the thing, sometimes, as I alluded to earlier, like the patients have trouble exactly explaining maybe what it is that maybe they say, like, I just can't walk right, or like my leg doesn't want to lift. That's okay too. Like acupuncture can probably help with that. It doesn't necessarily have to be like, pain per se. So functional deficits like decreased range of motion, I feel tight, I feel, something like that. Obviously, acupuncture can help with that too. But aside from that, other things are what I talked about, like, so like irritable bowel syndrome, for example, like just improving digestion is one thing that it can help with. Kind of sleep, insomnia, that's something else that it can really help with. What else? I mean, allergies, it can help with allergies. But some of these other indications, they're not, they take longer. So, the irritable bowel, it's not like one treatment and you're like, with the pain, you notice an immediate response. So you're kind of like, oh, okay. But the other stuff is a little bit slower and takes a little longer.
Got it.
Mm-hmm.
And you actually helped me with another thing. So I get motion sickness very easily. And so Dr. Tang showed me where on my ear I can put beads as well as at my wrist. And so I still, you showed me that, I don't know, 5 or 6 years ago. Yeah. And I still use it, and I use it on my kids too. It's actually really helpful. Yeah.
And that's a nice thing. Acupuncture, yes, the needles is one thing, but there's other tools too, like either the beads, you can put those, usually that's for the ear. There's something else called moxibustion, which I've been recommending a fair amount for patients now. And that's what it's like a cigar shaped thing, and it's a herb that's burned, and you put it over different acupuncture points. It could actually help with a lot of like rheumatological conditions, but that's also more of like a slower treatment. So it's not like you would notice immediate improvements, but I've recommended, you can just buy it on Amazon. So I've recommended that for a few patients.
Well, that's great. I think it's been a great conversation. Would you have anything else to add that we didn't talk about?
This is something I'm very passionate about. I think just how well it works. I do a lot of the other injections, the typical things that the ultrasound guided injections, the fluoro back injections. I do nerve studies, all these things. But really, the acupuncture has been a game changer for me. It's just that actually, I think that the reliability of getting improvement is probably higher with me using the acupuncture. I know it's higher than doing a lot of these other injections. And the fact that it doesn't have any side effects. A lot of people can't take certain medicines. They get different side effects from things. The fact that it's like, it's basically totally natural, I think that these are all really great aspects of it that I feel like, have really makes me very excited about it and passionate about doing acupuncture.
That's great. I think actually you brought up a great point as to how much you can use it, because we've been studying the Living Well Center patients that come through. So we've been a virtual center for a few years, and then we finally got to move into our beautiful space, which actually you can see behind me. This is our teaching kitchen, and I'm sitting in our conference room. But what we've found in patients that have kind of gone through our program is that that the couple of things that they point out that were so kind of pivotal to their improvement, one of them was acupuncture, and I think that you can, the numbers just kind of speak for itself. And the thing I think that really changed for people was that their ability to move. So for the Living Well Center, our whole focus is to be able to improve function, decrease pain, and get people to their goal, whatever it is. And usually it's some kind of functional goal. So if you can move better, then you can actually start to see more significant change and have less pain. So that acupuncture piece was so important, and it's a shame that it's not as paid for by third-party payers such as insurance plans, but hopefully in the future it will be more accessible to people.
Mm-hmm. Yeah. So, and that's another kind of thing that I'm looking into is just, I think it needs to be used more often and earlier on. I think it works like, the Living Well Center patients, usually it helps get the ball rolling. Like a lot of times these people are stuck and they just can't move and because of so much pain, but the acupuncture can, get the ball rolling. And I think it's the best first step because it has the most dramatic effect in terms of the getting some pain relief and movement improvements. Yeah.
Yeah, and I mean, in a perfect world, you'd have an acupuncturist in the ER. You'd have them at urgent.
Right. Actually, you're right. Yeah, they have acute pain acupuncture treatments too. Mm-hmm.
Yeah, it would be. I feel like there's so many opportunities for it.
Yeah.
Oh, that's great.
Exciting.
Well, thank you so much, Dr. Tang. I know you're busy, and I really appreciate you taking time out of your day to talk with us. It's been a great conversation, and a great way to highlight, what we're doing here at the Living Well Center at Washington University in the Department of Orthopedics. And if you want to find out more information about it, you can visit us online at our website, which is ortho.wustl, which is wustl.edu, and then also at our Facebook page. So we have future broadcasts to look forward to as well. But thank you so much for your time, Dr. Tang.
It's always a pleasure. Thank you.